Mental health support in Singapore is evolving fast. Therapists say there are now as many as 400 different therapy approaches available in Singapore. That's roughly twice as many as a decade ago, as new creative and trauma-informed treatments become more popular. But with so many options, how do you know what really works? Nadine Yeam finds out why, for many, the hardest part is still taking that first step.
When Sabrina Han was in school, she was bullied for how she spoke, acted, and for her autism. With nowhere else to turn, she sought help from her school counsellor, and at just 17, was diagnosed with anxiety and post-traumatic stress disorder.
Some friends are understanding, but some they just distance themselves. Maybe they did not know how, like how to support, or they have enough problems in their life. They don't want the more problems in their life, so they just avoid.
Her recovery was a lonely one. But 2 decades on, she's found strength again through Club Heal, a recovery centre that helps people rebuild connections through art and peer support.
We use a very structured approach and evidence-based approaches to help people with mental health issues. Some of the common ones we use as clinicians would be CBT, cognitive behavioral therapy, some SFBT, eye movement therapies. But at the end of the day, we all use these models to help people. And maybe what's new about all these approaches is with time and research being put into all these things, people put a personal spin to it.
Therapists say that surge in demand began during the pandemic, when stress and isolation drove hotline calls sharply up, and even art and dance therapy sessions went online. One association told CNA it's seen a 30% jump in clients taking up creative therapies between 2023 and 2024, as more people turn to expressive outlets alongside traditional counselling.
There are people who may be suitable for counselling or psychological services, but there are people who do not talk much or can't verbalize too much and felt that suppressed by the emotion. Naturally, the easier way is through the arts. Sometimes such approaches are much easier to have them to express their emotions. So as therapists, we will be able to process and work with them.
For those with severe conditions like schizophrenia or major depression, medical treatments such as electroconvulsive therapy can still help stabilize symptoms. Experts say there's no single perfect method, only a continuum of care that people move through as they healed. But they agree on one constant: the first step, recognizing you need help and reaching out for it, is always the hardest.
One of the big things we do is to let people know that, these are all the options, we build out all these good options for you. We put them on the table. But at the end of the day, we also want to empower them to make the decision for themselves in a way that's best for them.
Today, Singapore has a growing network of over 200 mental health touchpoints, including professional bodies, community partners, and specialised helplines that serve the different needs within the community. So it doesn't matter if you're young or old, as long as you need help, there'll always be someone to lend a helping hand.